Recording and sharing my screen. Okay. Hey guys, yeah, so let me know if you can see my screen so we can get started.
Yes.
Okay, guys. So we already talked about laboratory studies, right? Last week we talked about CBC, blood chemistry, and some other studies, right? So what we're going to do next is talk about a little bit of X-rays. Okay, so we're going to begin with a little bit of history. Imagine it was year 1895. Uh, we had this person here, this scientific, who was Wilhelm Röntgen. Okay, he was once having some experiment as a cathode tube. Okay, there had some emission of a certain kind of radiation, an ionizing radiation, which actually didn't know about so far. So he had like this piece of metal at the end of the cathode, okay? And what happened next? To focus this kind of uh, beams, right? He wrapped his cathode with some sort of material. And at the other side of the room in which he was, he had a screen, okay? This kind of screen. So he didn't know, of course, what was going to happen. And he just noticed that when this emission of beams reached the screen on the other side of the room, this screen just turned green. Okay, and there's a missing slide here in which Mr. Rottingen put his hand between his cathode and the screen, and suddenly he had an image of his hand bones. So then he wondered what these beams were. So since he didn't know what it was, he called them X-rays. Okay. This discovery made him win the Nobel Prize, actually. What happened? Here, he had this metal component, and the emission of these beams were actually, well, had two main possibilities, okay? What are those possibilities? The beams that were at one side of the cathode reached the metallic piece and had like disrupted and separated these beams, making them like wider. Okay, this is one possibility. What is the other possibility? Is that the electrons that were inside this metallic piece were actually impulsed by these X-ray beams. So the electrons discharged to the other side of the cathode. So in any way, any of these two chances, we had X-rays. These X-rays, as you can see in the middle image, this is the image actually of the hand of Röntgen's hand, right? Of actually his bone hands. So they have some sort of frequency, right? When we're talking about uh, any kind of beams, they have their amplitude, right? Some of the beams that have higher amplitude, we can see them as a light beam. However, some others we cannot. And this is an example of lower amplitude radiations in this case. That would be an ionizing radiation. These X-ray beams can travel through the air and even through some objects that are way thicker than air. For example, books, trees, right? And we also have to consider take into consideration flesh, meat, muscles, bones, and all kinds of structures that make up our bodies. So we get an image of an X-ray, right? Taking into consideration, of course, the components of each particular tissue, we can have five main let's talk about it later. We have the different ossifications of each tissue or structure. So since these X-ray beams can go through the flesh and muscles and any kind of human body tissue, people who are the employees, right, that have this kind of job, always cover themselves for, they are almost all the time exposed to this ionizing radiation. So they have to look after some glands, like the thyroid glands, right? And some genitalia. So these X-ray beams, in most of the cases, they tend to be focused on one object or tissue according to its structure, right? So what are bones made of mainly? They have calcium, right? So if our skeleton, our bones didn't have calcium, we wouldn't be able to get this kind of images. Since we do, we can have all sorts of images according to the projection that we are going to ask for, right, as doctors. So imagine how many X-rays we would need to have a complete body scan. I mean, if we had a complete body scan for our patient, a lot of projections will be needed, right, to get just a few images. So this is the main point when we are talking about CT. So what is a CT? This is a computed tomography, right? Until this point, we were talking about X-rays. However, a CT is almost the same thing because it is also based on ionizing radiation. So how does a CT scan work? Here we have our patient that we already saw in some other slides. And here we have a cone, actually. This is called cone. Give me 1 second. I'm going to, okay. So this structure here is called a cone. And this structure can send the X-ray beams and keeps turning this way and goes all around our patient's body. Okay, so our patient gets inside this CT scan, and the cone keeps rotating around our patient, and is going to take a lot of photographs or X-rays that as long as it's working, right? So it's like this scan is taking a lot of X-rays, and that is the topic for tomorrow's class, actually. However, I wanted you to know that CT and X-rays are almost the same. However, in an X-ray, we can actually see in one main frontal plane or lateral plane, obliquous plane, right? So on the other hand, we have the CT scan, the computed tomography scan, which is like it's taking a lot of X-rays at the same time. That is why the CT scan is related to a more, well, like a higher dose of ionizing radiation. For example, a CT is has a range of around 7.8 to 8 of ionizing radiation dose, and PA chest X-ray is related to 0.3, 0.4 of ionizing radiation doses. Okay, so as a conclusion, we can say that CT can deliver a lot of more radiation, ionizing radiation than an X-ray. So here we have, well, what I was already mentioning, which is the X-ray densities. You all know this. However, I want you to focus on pronunciation. Here we have on one side, on your left side, we have the radiolucent, and on the other side, the radiopaque, right? The radiolucent, when we're talking about a radiolucent part of an X-ray, would be related to air, right? Right in the middle, we have the other two X-ray densities, which are the fluid and soft tissue. There we would also have the greasy tissue, right? And then we have the bone density, which is related to calcium, right? We also mentioned it. And then we have the metal density. Because of its composition, actually, most of the metal items used for orthopedics are related to a platinum structure, right? So, and since it has this kind of metal, which is platinum, it's a radiopaque density. So what do we use this image study for? Here we have on your left, we have a normal X-ray, abnormal posterior anterior thorax or chest X-ray. Notice that the term for this study is X-ray, and this is actually how it's written, right? Here we have some of the normal structures, the trachea, the spinous process, right? Which is from the vertebra, right? The clavicle, the carina. On your left would actually be the right hilum, right? Of the pulmonary artery. On your left, or on your right, I'm sorry, would be the aortic knob. Does anybody know what knob is in a daily basis, on a daily basis? I mean, in your houses, you have knobs, right? Does anybody know what a knob is? K-N-O-B. In Spanish, we call this structure el botón aórtico, right? However, in English, it's not a button, right? It is called knob. Does anybody know what knob is? You can find this on your doors. Hello? Okay, a knob is actually la cerradura, el pomo de la puerta, okay? So an aortic knob is just that, okay? In Spanish would be el botón aórtico, right? And we also have the left hilum and pulmonary arteries. In the lower part, we have the right atrium and the left ventricle. You also know that the right ventricle is actually not seen, or is just one little part of the right ventricle can be seen on a PA thorax x-ray, right? We also have the right hemidiaphragm and the left one. We also have the costophrenic angle. Costophrenic angle. Can anybody tell me what this costophrenic angle is most importantly used for? What is the importance of knowing the costophrenic angle? Hello, guys.
It's the part where you can find the diaphragm.
Okay, it's the point in which, this is the whole thing here is the right hemidiaphragm, right? And this point is the costophrenic angle, this point right here. So this is important because when we have a pleural effusion, you know what the pleural effusion is. In Spanish would be derrame pleural, right? So as you know, all liquids go down and all the gases go up, right? So when we have a pleural effusion, which is derrame pleural, it tends to go down because it's a liquid, right? And occupates this costophrenic angle. Does anybody know what a pleural effusion related to the costophrenic angle is called? I mean, we wouldn't have this angle in a pleural effusion. We wouldn't have this angle right here, this pointy angle. We would have something like this. Does anybody know what this sign is called?
Isn't it the trasudado?
Uh, okay, this is actually one type of pleural effusion. There are mainly two types of pleural effusion. Okay, what you called in Spanish would be exudado y trasudado, right? However, we're not talking about that in this case because we can define that kind of the type of pleural effusion when we take out this liquid that is occupying this space. However, we have this sign on an X-ray, which is this one. I'm going to say it in Spanish. Menisco, right? Y este es un signo de derrame pleural, la pérdida del ángulo costodiafragmático, o sea, el líquido del derrame pleural ocupa el ángulo costodiafragmático y se borra este ángulo. y se forma un menisco acá. ¿Alguien sabe el nombre del signo? Del borramiento del ángulo costodiafragmático con la presencia de un menisco líquido, que es signo de derrame pleural. Does anybody know? Okay. Did anybody read about the Elise Damaso sign? Elise Damaso. I'm going to write it down for you to investigate a little, okay? So, okay, you can see my screen, right? I know that you have read about it. You're just scared of talking, I guess. It's written like this, okay? Elise Damaso sign. Okay, this is actually just as I was telling you. Okay, as I was telling you. Okay, as I was telling you, here we have the costophrenic angle, right? Ángulo costodiafragmático, this angle right here, formed by the ribs, right, on one side. And on the other side, we have the diaphragm, right? And here we have this angle. When we have, when our patient has pleural effusion, this liquid tends to go to this angle because it's the lower part of the whole thorax. Okay, so they tend to the liquid tends to go to this angle. And if we have this angle erased, like this whole part is white and we do not see this angle, we can say that some liquid is occupying this space. And as I was telling you, there's like this shape, and down here we have the liquid this way, right? And we would have this curvy line right here. And this is the Elise Damaso sign, okay? This is a sign of pleural effusion. Does anybody know what volume of liquid takes to erase the costophrenic angle? I'm going to say it in Spanish because I know that you already read about this. ¿Alguien sabe cuánto líquido de un derrame pleural se necesita para borrar el ángulo costofrénico o ángulo costodiafragmático? Actually, in a PA X-ray, like this one, we have two angles, right? The right one and the left one, right? However, if we see a lateral view, a lateral projection of an X-ray, we would have something like this, like the chest. And as you know, this is the diaphragm, okay? And we would have that this, here we would also have a costophrenic angle. This would be the posterior costophrenic angle, okay? And the lateral ones, the right one and the left one, are somewhere near here, okay? So we can say that the posterior costophrenic angle is much lower than the lateral ones. The right and the left ones are like higher, and the posterior one is lower. So where do you think the fluid is going to go first? To the posterior one, right? Because it's lower than the others. So when we see an X-ray, and in this case, the most commonly used projection is actually this one, right? The posterior anterior thorax X-ray. So we would if there is some liquid here and we see the Elise Damascene sign erasing the costophrenic angle right here, we would have to assume that we at least have 75 milliliters of fluid. This one, okay? However, I'm sorry, this one is 150, okay? 150. However, as I was telling you, the posterior one needs less fluid to erase the posterior costophrenic angle because it's lower, right? So how much fluid do we need to erase this posterior costophrenic angle? We just need 75 milliliters, okay? And here, if we see this angle erased, we need the double as in this one, right? Here we would need 75, and here we would need 150 milliliters of fluid to erase this angle. And this curve here is the Elise Damascene sign, okay? Can anybody tell me what the cardiothoracic index is? Hello, guys. I know that you read about it.
Like the formula?
Sorry, I didn't listen.
You mean the formula?
Not the formula. What? Because it's easy, right? One A plus B divided into C, right? However, what is this used for? Cardiothoracic index. What is the main use of this index?
It is used to know the size of the cardiac silhouette.
Silhouette. Yes, great. So it is telling us like the size of the heart, right? Could you tell me any kind of disease that this cardiothoracic index could be related to, an increased cardiothoracic index?
Cardiomegaly.
Okay, what kind of disease could cause cardiomegaly?
Chagas.
Awesome, yes. Chagas disease is actually related to an increased cardiothoracic index, right? So it's like the heart gets bigger and bigger and bigger. So this formula is going to give us a different cardiothoracic index, which would be pathological, right? So yes, Chagas disease would increase the cardiothoracic index because the heart would be bigger than usual, right? Can anybody tell me what COPD is? I know that you read about it in Spanish. It's a really famous disease. Does anybody know, guys?
Enfermedad pulmonar obstructiva crónica.
Great. So could you tell me the name in English? Here you have the abbreviation, right? Could you tell me in English?
Chronic obstructive pulmonary disease.
Great. Chronic obstructive pulmonary disease. Okay. So what would you find in an X-ray in a patient with COPD? What would be the findings on an X-ray in a patient with this diagnosis? Hello?
A airflow blockage.
Okay. And how would we see that kind of finding in an X-ray. Here we have what you said, hyperinflated lungs, right? If you compare this one, this pathological X-ray to this one, here we can see like the blood vessels can be seen, right? Blood vessels and the hilum is quite notorious, right? Right here, and the blood vessels do not have to pass the 2/3, right? However, notice that it's like grayish, right? Like gray. However, what about this one? It's like darker than the normal ones, right? So it's like darker, more blackish lungs areas. So that is hyperinflated lungs. What you said is related to it, right? What else would we find in a patient with COPD? Besides hyperinflated lungs? What about this structure right here, which is the diaphragm? What about the diaphragm? Hello, guys. How do you say flat in Spanish?
Plano.
Great. So we have flatter diaphragm. You know the ER means more than, right? To compare. So in this case, a flatter diaphragm, we are comparing this diaphragm with a normal diaphragm. So what we are basically saying here is that the diaphragms, the hemidiaphragms, both right and left ones, are flatter than usual. Okay, because we have trapped air right here. So the diaphragms get flatter. Okay. And what about the heart? Compare this heart to this heart. This actually. This is a normal heart right here, right? And compare the shapes with this one. This is longer, right? How do you call this shape? I mean, we have air that is trapped in the peripheral lung space, right? So our diaphragms are also flatter because we have space full of air right here. So the diaphragm gets flatter, right? And for instance, the heart gets longer than usual. How do we call this? Well, this is a heart. There's an H missing here. The heart longer than usual, than normal. And does anybody know what this sign is called? A heart that is longer than normal. In Spanish, maybe. Okay, in Spanish would be corazón en lágrima, en gota. Okay, so we have a teardrop heart. Teardrop heart. Okay, so we can find a teardrop heart in COPD. On your left, we have anteroposterior abdomen X-ray, right? And on your right, we can see the coffee bean sign. Also, well, we know this sign in Spanish as it's this one, right? And this name in English. Can anybody tell me the name of this sign in Spanish?
Signo del grano de café.
Great. However, in English, we also have this name for the same sign, the whirl sign. Okay, does anybody know what whirl is? Whirl? Okay, it's like turning all over and all over again. A hurricane, for example, whirls. Okay, so this is the whirl sign. And what disease is this sign related to, for example?
Vólvulo.
In which part of the large intestine?
Sigmoideo.
Great. So this would be a sigmoid volvulus. In English, would be sigmoid, right? Volvulus. Okay. Okay, here we have on your left, we have an AP and lateral forearm X-ray. You always have to ask for two different projections. Here, when we're taking into consideration the forearm, you always have to ask for an anteroposterior and lateral projections. Okay. And here we have all the structures that are related. We have the radius, the ulna, the trochlea, and all the bony structures, right? On your right, we have a fracture, right? What would this fracture be? Maybe the bone name of the fractured bone.
It's the ulna.
Sorry?
Ulna.
Ulna, yes. Because the fibula is in the leg, right? Here we have the ulna. Okay, so this would be an ulnar fracture, right? Ulnar fracture. Can anybody tell me what this different projection is all about? An extra point for the person who answers. This is a projection used to see sinus. Can you tell me what projection this is? Well, here we have the X-ray beam. So since the X-ray beam is coming from the posterior part to the anterior part of the skull, right? This would be, first of all, a posterior anterior one. However, here we have a main angle right here of 15 degrees, right? So here we have the X-ray detector. And since the X-ray beam is related to a 15-degree angle, we would have a different projection. This is actually a projection called catwell projection, okay? We can see the sinus here. What kind of sinus for, could you tell me the name of the disease that we might be thinking about or might be thinking of? when asking this kind of projection? In English, of course. Hello, guys.
Maybe with someone has sinusitis. Sinusitis.
Yes, great. And what kind of sinuses would we be looking at with this projection? The maxillary sinus. Here we can see clean sinus, right? This would be it, right? And on the other side, you can see without drawing, we have like clean maxillary sinus, right? Well, what would we find if if we had an infectious process in the sinus? We would have like a line here, and the lower part of the sinus would be not full with air. It would be full of mucus, right? We would have this all the whole sinus occupied. However, we would see this line here. In Spanish would be nivel hidroaéreo, right? If we see this sign, we would actually have mostly a diagnosis based on your accuracy when you're examining a patient. And if you have this catwalk projection, for example, and if you see this sign, you would get your diagnosis. In this case, maxillary sinusitis, right? So, does anybody have a question about X-rays? Could you tell me any other uses, for example, when related to contrast? Any use of an X-ray related to a contrast, guys? Hello? Maybe for cardiology, gastroenterology. Anybody? Does anybody have any kind of doubt?
No.
Okay. You see my screen, right? Okay, here we have another image study, which is ultrasonography. So what is an ultrasound imaging? In, at least here in my country, in Bolivia, we don't usually this word in Spanish, ultrasound. However, it would be correct. But we mostly use the word ecografía, right? So ecografía y ultrasonido son lo mismo, okay? So in English, it is mainly known as ultrasound, okay? So what are we going to talk about today? This is the last part actually of today's class. It's, well, we're talking about what uh, is ultrasound imaging, why ultrasound, some common uses, a little bit of history, properties of ultrasound equipment, how does the procedure work, and some benefits and the risks. However, the risks are mostly none, right? We already talked about X-ray, which in which, well, trained personnel use ionizing radiation. So the personnel that is already trained have to protect themselves, right? In this case, no protection is needed, and the patient has a very low risk of any kind of mm, risk related to the procedure. Okay, what is the general what is general ultrasound imaging? As you can see, this imaging study is in English is also called sonography. However, it is most commonly known as ultrasound, right? And it is by its abbreviation would also be called US, okay? Ultrasound. And it involves exposing parts of the body to high frequency sounds, actually waves, to produce pictures of the insides of the body. How does this work? So um, we have this equipment that sends some low frequency, high frequency sound waves that bounce from deeper structures, go through the equipment into a screen, right? And there we have an image of internal organs. And an ultrasound examinations do not use ionizing radiation as the ones that are used in x-rays, as I already told you, right? And in a higher radiation dose, a CT, right? Because the ultrasound images are captured in real time, they can show the structures and movement of the body's internal organs, as well as blood flowing through blood vessels. Can anybody tell me what this last part is related to? What kind of study related to the heart? In Spanish, you can say it in Spanish in this part. What kind of ultrasound study can tell us about blood vessels and blood flowing through it?
Una ecocardiografía.
Right, yes. Okay, that would be it, right? Related to cardiology. As you can see here, the ultrasound, also known as US, right, is the most widely used imaging technology worldwide. And it is popular due to availability, speed, low cost, patient friendliness. I mean, there's no radiation, as I told you. We have on one hand the ultrasound, and on the other hand, we have the x-rays and CT. We also have some different kind of imaging study, which would be the MRI, right? Which we're going to talk about tomorrow. This ultrasound is applied in a lot of specialties, such as obstetrics, cardiology, internal medicine. As you can see here, internal medicine is also known as inner medicine, okay? Urology and a lot of more specialties. It's going on ongoing research to improve image quality, speed, and new application areas such as intraoperative navigation and tumor therapy. For example, could you give me tumor therapy that would be related to ultrasound?
Sorry, I have a question. What does ongoing mean?
That is continuous. Something that is continuous. In this case would be investigación continua, right?
Okay.
Okay, so can anybody tell me any use of ultrasound related to tumor therapy? Okay, when we have a localized tumor, okay, For example, in the liver, okay, you know what liver is. So we have this patient who has a tumor inside his liver, okay? Imagine before going to surgery, we need to give our patients some kind of medication to decrease the size of the tumor. So that would be chemotherapy, right? So we have some chemotherapy that is guided by ultrasound. I mean, we have the syringe with the chemotherapist, and we have our equipment, our ultrasound equipment to guide our needle, our syringe, to instillate the chemotherapist directly into the tumor. Okay, that would be one simple example of how ultrasound is related to tumor therapy. However, this, of course, needs person, personal that is highly trained, right? What are some common uses of the procedure? The ultrasound examinations can help to diagnose a variety of conditions and to assess organ damage. Does anybody know what assess mean? This is a verb, actually, this one. Assess. Does anybody know?
Like to check.
Okay, yes, it would be close, yes. It's like analyze, right? To analyze, to assess, okay? Organ damage. As you can see, we have, this is a real-time imaging study, right? So we can directly see how organs are damaged by some condition or illness. And the ultrasound is used to help physicians to evaluate symptoms as, you know, pain, swelling, infection, hematuria, which is blood and urine, right? So could you tell me any examples about pain? Ultrasound is highly used when we're talking about stomach aches, right? To assess if our patient has some acute surgical abdomen, right? If our patient has, for example, an obstructed biliary duct, that needs to go on to surgery. When we're talking about swelling, to determine how this swelling is affecting different internal layers of a determined tissue, right? An infection, if, for example, we have an abscess, right? And we want to see the diameter of the abscess, and if there's any other structures inside of it. And what about hematuria? Can anybody tell me how would we use ultrasound when we're talking about hematuria? You know, hematuria could be present in some different kinds of diseases. For example, in we were talking about urology, we might be having a patient who has kidney stones, right? So the kidney stones can travel through the urethra, right? And make a person's bladder to bleed. And as a result, we would have hematuria, right? We would also have, for example, a different kind of hematuria, which would be related to the kidney. Okay, so when we're talking about hematuria related to kidney, we would have like there is no kidney stones all over the urinary system. However, we would have to look for, we would have to ask for a laboratory. Does anybody know what kind of laboratory we would ask for when we're talking about um, a normal urinary tract related to hematuria? I mean, in an ultrasound in a patient, there would not be a kidney stone, but our patient has hematuria. So what would you ask for as a doctor, as doctors? Okay, anybody?
Could it be a bielogram, I think?
Okay, that is an imaging study, right? Uh, we actually would use that to determine if there's like reflux of the urine. Okay, especially when we're talking about newborns. When a newborn that is a male newborn, we would have to ask for this kind of study. Okay, a patient, a newborn who has an urinary tract infection is not common. What is mostly common is that females get urinary tract infection. So if a male newborn has a urinary tract infection, we would ask for it because there has to be some anatomical disarrange. So this imaging test would be to determine if there is some urine reflux, right? However, we would have to ask for a different kind of laboratory study, which would be to see under the microscope the morphology, the shape of those red blood cells. Okay, so if we have normal red blood cells, it means that this blood is coming from the urology tract. Okay, so if we see regular or normal uh, red blood cells, then the blood is coming actually from the urethra, the bladder, or the urethras. On the other hand, if we see hematuria, but if we ask for this laboratory to see the shape of the red blood cells under the microscope, and they're all dysmorphic, which means that their shape is actually disarranged, we would have to think about some kidney problem. Okay, so that would be it. Okay, for you to know in the future. So an ultrasound is a useful way of examining patient of a lot of the body's internal organs, including but not limited to the heart, blood vessels, including the abdominal aorta, and its major branches: the liver, gallbladder, spleen, pancreas, kidneys, bladder, uterus, ovaries, an unborn child, which is a fetus, right? In pregnant patients, eyes, thyroid and parathyroid glands, scrotum, brains in infants, hips in infants. Can anybody tell me the use of ultrasound when we're talking about the eyes, maybe? Because it's not really common to see, right? I mean, when we are talking about ultrasound, everything you imagine is abdomen, maybe some other soft tissues like skin, or in Spanish, tejido celular subcutáneo, right? Maybe gallbladder. But what about eyes? Can anybody tell me the use of ultrasound when we're talking about eyes?
I think it could be used when the cornea is, I don't know the word in English, opaca.
Okay, opaque. Okay, that could be one use. However, there's another um, imaging study for the eye. Okay, would be which would be CT. Tomography is actually used by a lot of ophthalmologists. However, when we're talking about ultrasound, for example, when I had my rotation in ICU, okay, we have this, a lot of patients had bumped their heads, right? In Spanish, uh, those would be tech, right? So in patients who have this diagnosis, like a trauma, right? The the brain gets inflamed and it mm, takes a lot of water from peripheral structures, so there's edema, right? So the brain increases its size, okay? And therefore the intracranial pressure increases. So when there's increased intracranial pressure, the diameter of the eyes can vary. If it is higher than 5 millimeters, it is a sign of increased intracranial pressure, for example. Okay. You already know what how to use the thyroid, how to use the ultrasound for thyroid and parathyroid glands, scrotum. What about hips? Can anybody tell me the use of ultrasound when we're talking about hips in infants? Maybe in Spanish, if you can tell me. I know that you know this kind of stuff.
Well, it's used to see the development of the femur and this is going to be in Spanish, but la unión de la cabeza del fémur con la cadera en sí.
Okay, great. And yes, the femoral head, right? The development of the femoral head. Okay, great. What about the scrotum? We have diagnosis, which is acute scrotum, right? When there's trauma related to testicles, we have ultrasound for scrotum, right? To get the knowledge of how the blood vessels are affected, right? And the torsion of the spermatic cord, because it would have, if there is a like if there is a compromise of these structures, this person would have to go immediately to an OR, right? So some applications in obstetrics to follow the fetal development and to detect pathologies. Applications in cardiology. So here we have blood flow in vessels. Here we have a Doppler ultrasonography, right? To see the blood flow inside the vessels, the contraction and rhythm of the heart, blood flow in the heart, for example, defects on the wall muscle, and valve defects. Can anybody tell me about any kind of wall muscle defect? Hello, guys. For example, when there's communication between the two ventricles, right? What would that be? For example, in some kind of syndrome, maybe?
I thought it was only in the abdominal part.
Sorry?
Like I only know an abdominal wall defect. I didn't know it was a cardiology thing too.
Okay. I see where you're going. You know, there are walls between both ventricles and both atriums, right? So between, for example, between both the ventricles, we have a wall actually, right? That separate the left one and the right one, right? So there might be some defects on this wall between both ventricles that, for example, uh, we have a defect that communicates both ventricles, right? Sorry, I'm going to, okay. Here we have this wall between both ventricles, okay? For example, and this has to be a continuous wall, right? With the well, I mean, there would be no defects. However, if we have like a hole right here, the since this left ventricle is contracting and it is much thicker than the right ventricle, the blood would go this way from the left ventricle to the right ventricle. So when we're using Doppler ultrasonography, we can see the blood flow. So we would see an abnormal flow of blood going from the left ventricle to the right ventricle. Okay, that is actually called a shunt. Okay, does anybody know what a shunt is? In Spanish, maybe? Un cortocircuito, right? So in Spanish, we would have un cortocircuito, en este caso, izquierda-derecha, right? Because the blood is going from the left ventricle into the right ventricle. That is what this is called, a left-right shunt, which is going from the left, well, the blood is going from the left ventricle into the right ventricle. So as you can see, we can see structural imaging according to the walls of the heart, right? And we also can see functional imaging. Functional, we are talking about the blood flow. Okay, so the blood flow in the heart, as I was telling you, we can analyze or assess defects of on wall muscle or valve defects, and also the assessment of cardiac perfusion. You know, the first branches of the aorta, do you know what those are? The first branches of the aorta artery? Las primeras ramas de la aorta, ¿cuáles son, guys? Come on, guys. Coronary arteries, okay? So we can analyze the blood flow on the cardiac perfusion through the blood flow of the coronary arteries. How well this cardiac tissue is getting blood, okay? Some other applications in inner medicine, for example, gallstones. You know, this is a gallbladder, right? You know what a gallbladder is, right? Vesícula biliar. This would be it, okay? Okay. Here we have our equipment right here, the ultrasound, and it's like shooting some high frequency beams, right? Ultrasound beams. And as you can see here, I mean, our equipment, our ultrasound equipment is throwing away beams in different directions. Okay, so we can see here we have, for example, you can see the wall of the gallstone, the gallbladder, right here. So as it is a thick structure, the beams, the ultrasound beams are going to bounce right into our equipment. Okay. However, here you can see air, right? And inside of it, of the gallbladder, we can see a gallstone. This is what this is called. In Spanish would be un lito, right? Un cálculo, right? So this, does anybody know what this, you can see right here, it gets darker from the rest. Does anybody know what this sign is? Here we have the gallstone, right? And it is thick. Actually, this kind of gallstones are made of cholesterol. Okay, those who are this is actually a secondary gallstone, because the primary gallstones are formed in the biliary ducts out here. Okay, and they are made of pigment. However, the um, secondary gallstones are actually mostly made of cholesterol. Okay, so here we have a gallstone, and here we have this beam, and it's going, since this is a hard structure, it's going to bounce in this direction to our equipment. Okay, and since these beams cannot go through our gallstone, this is going to form this sign. In Spanish, maybe, guys, uh, does anybody know what this sign is called? You have it here, actually. This is an acoustic shadow. Okay, it's like a shadow. We all have shadows, right? When we have the light, the sunlight, and we can reflect, well, we can see our shadows. This is like the shadow of the gallstone. This is actually called the echo sign, like this, with no H in between the C and the O. Okay, does anybody know what this is? Okay, you're going to find out by tomorrow, okay? Here we have a perfusion Doppler image of the for renal transplant to see how well our our patient is adapting to renal transplant, renal transplantation, actually, right? So when we have our patient who has just had a transplant of any kind of organ, we have to assess, we have to analyze how well the perfusion of this new organ is going, right? Because if we had this kidney right here, you can see the kidney shape, right? If we can see the kidney here, and it's if we have a perfusion Doppler, we're analyzing the blood flow of this organ. What about if we have this kind of patient and there is no blood flow in here? That would mean this organ is not well accepted by our patient, right? So we might have to even remove it again. Some applications in musculoskeletal system. It is the visualization of tendons, ligaments, investigations under movement if is possible, and simplifies the detection of ruptures and obstructions. Here we have an image, and the arrows show the large gap of rupture of Achilles tendon. Here, right, you can see, you know that we have in our legs, we have in the posterior part, we have a gastrocnemius. That is the name of the muscle, right? And it has a tendon that goes deep down and inserts into a bone, right? And when there is a rupture of the Achilles tendon, we can use the ultrasound to determine how far from each other the gaps of the tendon have in between, right? Some applications of ultrasound elastography. Ultrasound elastography is often used to classify tumors. Malignant tumors are 10 to 100 times stiffer than normal soft tissue around. So what is elastography all about? We can see, here we can see actually the tumor is highly noticeable, right? In red. As it is written here, does anybody know what stiff is? S-T-I-F-F, rígido, right? In Spanish would be that word. So tumors, especially malignant tumors, are stiffer than the normal tissue that is around it. So elastography can tell us about how stiff a structure is. And since malignant structures or tumors are stiffer than the normal tissue around it, we can identify a tumor, a malignant tumor, okay? Some properties of the ultrasound. The frequencies of medical ultrasound waves are several magnitudes higher than the upper limit of human hearing. That means we cannot hear ultrasound waves, right? Here we have the range of acoustic waves. From 20, there would be actually some supporters that are not shown here. Around 20 hertz, we have our acoustic range. Okay, and we were talking about ultrasound. We're talking about 200 hertz, megahertz. Okay, so we cannot actually hear ultrasound waves because of, in Spanish would be longitud de onda, right? So here we have some common sound frequencies. An adult audible range is between 15 and 20,000 hertz. And on the other side, we have a medical ultrasound. It's from 2.5 to 40 megahertz. Okay, so this is way beyond what we can hear. So that is why we cannot hear ultrasound waves. Some physics of the method, longitudinal mechanisms of waves, and this needs elastic medium, which is the transducer, right? Which is the part of the equipment. We have actually a lot of shapes of transducer. And each one of the shapes is related to some specific structure. Okay, so there's an abdominal transducer, there's a cardiac transducer, there's an eye transducer, there is soft tissue transducer. So there are a lot of types of transducer related to one specific kind of tissue. Okay, and the component resolution, it goes from 3 megahertz, which is related to 1.1 millimeters, from to 10 megahertz, which is related to 0.3 millimeters, so much smaller structures. And the wave velocity, in fact, we have, well, the velocity or speed of a wave, an ultrasound wave, varies depending on what kind of tissue we're examining. For example, when the ultrasound waves go through fat, they have a speed of over 14, 15 meters per second. And on the other hand, if it goes, well, if the Ultrasound waves go through the muscle. They have a speed of 1,580 meters per second. So here we have some ultrasound parts when we're talking about obstetrics, right? And because here we have a fetus, here we have the transducer. This would be the transducer, right? Transducer pulse controls the frequency, duration, and scan mode. When we're using an ultrasound machine, we have different modes. For example, we can stop the image and we can measure the diameters of a structure, as I was telling you, the eye diameter, right? We also have a printer, a transducer, the sound backing. This sound backing means that the ultrasound waves can bounce, right? And go to the sound backing, okay? The PZ crystals and the keyboard, the disk for storage, and the display, which would be the screen, right? The ultrasound machine, a basic ultrasound machine has the following parts. The transducer probe, the probe that sends and receives the sound waves. The central processing unit, the CPU, the transducer pulse controls, the displays, keyboards, disk storage device, and printer. It's like a whole computer, right? What is the future of ultrasound? It would be improved clarity for using cancer diagnosis, as we were talking about elastography, right? Increased therapeutic use to correct blood clots and kidney stones. Does anybody know what kind of study this is, or therapeutic, this one, to remove kidney stones? Maybe in Spanish, ondas de choque de alta frecuencia, maybe. When you get to the urology part, there is some kind of non-invasive treatment for kidney stones, okay? It's like we have our equipment, our transducer, right? And it sends really powerful ultrasound waves that destroy the kidney stones. So there would not be necessity for surgery anymore, okay? That is actually one type of therapeutic use of ultrasound. It will be more portable, and even in some veterinary use, the joint and muscle treatment through cavitation. So guys, we actually surpassed our time. So I'm going to ask you to fill in the survey, please, because it's already too late. And let me know when you're done, please. Remember, tomorrow we're going to have our practice class. As you can see, we do not have the problem that we've been having last week, right? So tomorrow we will not have any kind of problems. We're please join the meeting before the 10 minutes past 8, okay? And I hope you have a good night, and we will be talking about this tomorrow, okay? So have a good night's sleep, and I'll see you tomorrow. See you guys.
Goodbye.
Bye. Good night.